Hello and welcome to today's webinar. I am Engineer Abdul Desari, and I'm going to talk about quality certificates. In this presentation, we are going to cover the type of medical devices certificates, notifying bodies, method of verification, and we will end it with a live example of how to verify your certificate and how to check if your certificate is recognized by an accreditation body. There are two types of certificates. First type is the QMS, or the Quality Management System. A QMS is a certificate issued to the physical manufacturer by a recognized conformity assessment body, stating the compliance of the manufacturer's management system to international quality standard. The second type is a QAC, or Quality Assurance Certificate. A QAC indicates that the product compliance has been established using the appropriate conformity assessment procedures. The essential requirements are requirements related to product safety, public health, and consumer protection. For the QAC, we accept only the full quality assurance system, which it covers the entire system from design, manufacturing, and final inspection. The EC design is not mandatory, but it's required in some cases, such as if the medical device or IVD risk classification is Class 3 for medical device, or Class D for IVD and registration. But in the importation, it's only required if it was asked for. NHRA does not accept the Production Quality Assurance Certificate, as it's not the same as the Full Quality Assurance Certificate. We understand that they are different routes, but the Production Certificate lacks some compliance in comparison to the Full Quality Assurance route. Moving on to the QMS. NHRA accepts only the ISO 13485 and the new MDR and IVDR certificate if they are recognized by the NANDOs. To those who are not aware of the new MDR and IVDR certificates, in summary, those new certificate is a merge between the EC and Quality Management System requirements, which is more comprehensive and detailed compared to the MDD. All certifying bodies issuing the certificates must be recognized by the NANDO list in the EU for CE certificates and IAF for ISO certificates. The NANDO list is a list of the approved or recognized notifying bodies in Europe. The Emergency Use Authorization, which is a new supportive document we accept only for the COVID-related shipments, but it must be issued by a reference country, and you can see the list of reference country by scanning the QR displayed. Also, the document must be verifiable and written in either English or Arabic. And here are some examples of the most known certifying bodies by NHRA. Certification process. The accreditation body accredits a third-party notifying body to inspect and evaluate the manufacturer, and if all the requirements and standards are met, the manufacturer will obtain the certificate, either it's QAC or QMS. Then the agent or applicant will get the certificate from the company or manufacturer, which he or she will verify the validity of the certificate with the notifying body before submitting it to NHRA. Here is an example of a certificate. The certificate must contain a notifying body, logo, manufacturer and country of origin, scope, standard, and a validity date. There are two methods to verify the certificate. The first method is online. Most of the notifying bodies share their certificate database to the public, so the applicant can check through the website their certificate validity. If the notifying body does not provide an online database, there is a second option, which is sending an email to the notifying body asking for a validity confirmation for the certificate. But in this case, NHRA should be in the mailing loop. If the applicant couldn't manage that, an attachment of the original email must be sent to NHRA's email. Before we start with our live example, I would like to inform you that you can find a library of useful links that we try to keep them updated in medical devices section on NHRA's website. And to find them, you go to Departments, MDR, Useful Resources, Quality Certificates, then Website Links. Let's take this certificate for example. First, we have to check the standard, and since it's the EC certificate, we have to see if it's recognized by the European Commission or not. So you visit their website, go to search, then do list. Okay, so you have two options now. Either you search by country or by either the name of the notifying body or the identification number. Let's go with the identification number, and since it's 0197, you go to the range, you choose. Here it is. Okay, we visit their website and we try to search for any database for their certificate. Like this. We go to detailed and we write the registration number of the certificate. Here, and it shows that it's no longer available. Okay, let's check this certificate now. First, we have to find the standard, and it's ISO. And since it's ISO, we have to look for three more things: the certifying body, the notifying body, and the country where the certificate issued. Now we go to the IAF. When we first enter the website, we go to members, accreditation bodies. And we have two options now. Either we search by name or by country. Let's search for by country and go to Germany. Here it is. We enter their website. And we have to search for a database for their accredited bodies. Now we have to enter the full name of the certificate issuer and their activity. Okay, since now we confirmed that the notifying body is recognized, we have to check if the certificate is still valid or not. We can either do it by the QR here, or we can visit their website. Okay, since we are now in the notifying body website, we try to find a database for their certificate. And now, since we found it, we enter the certificate number on the search box. And this is the result. You can see the certificate information, the customer information, and share it with the QR code. And the certificate stated is valid. Thank you for attending the webinar. If you still have any doubts or a question, feel free to ask.
Thank you very much, Engineer Abdallah. Please raise your questions in the Q&A part. I know you have a lot of questions. While we go through your questions, Mr. Abdallah, you can please share your presentation, and then we can move to the Q&A part.
Barakatuh. Welcome to NHRA Medical Device Webinar. Today I am going to explain the importation process. We will start with what is UFOQ, then I will explain how to use UFOQ. Also, I will talk about UFOQ required documents, and finally, I will talk about some issues regarding UFOQ. First, let's talk about what is UFOQ. UFOQ is a web-based software developed by Customs Affairs to monitor and control all shipment accessing the Kingdom of Bahrain ports. This is UFOQ first page. To create a new request, we should click on license here. It's number 1. Then number 2, we must enter the correct ministry code. Ministry code for NHRA is 2251. Number 3 is the request reference number. It's auto-generated by the system. Number 4 is the license type. Make sure that it is single use, as NHRA does not accept any request with multiple use. Number 5 is the CR number box. It should automatically fill with your company CR when you log in with your user. Number 6 is the request date. Number 7 is the request validity date. We recommend to put 1 year validity. Number 8 is the request status. Here you can see your request status, if it is reviewed or not. Then you must click on item down there below, number 9, to go to the second page. Here is the most important page in your request. Number 1 is the country code box. It is mandatory to put the country code, so make sure that you enter the correct country code. Number 2 is the HS code box. Please enter the code that match the code in your invoice. We received many questions about the meaning of HS codes. The HS code, it's a coding system for all the products. It's developed by the World Customs Organization. Here's some examples for some HS codes. Let's continue with UFOQ. So number 3 is the space code. This box belongs to code number 90189090 to separate the items that are not exempted from the tax. Number 4 is the amount box. Here you must enter the correct invoice amount without any additional charge or discounts. Always make sure that you not enter any additional charge, for example, the shipping cost. Also make sure if your invoice contain a discount, put the price without discount. Also, if your invoice contains discount, make sure that you put the original price without the discount. Number 5 is the medical device fees. Here you should enter the correct type number. For example, if your invoice contains 2 devices, 1 ultrasound and 1 laser machine, in this case, you have 2 types. If it is registered, you should put 2 in the registered box. If not, you have to put 2 in the unregistered box. Second example, if your invoice contains 10 contact lenses, all of them are calculated as one type. Also, one more example, if your invoice contains 4 items, 2 dental implants, one of them size 1 and the second one size 2, and 2 dental tips, also one of them size 1 and the second size 2. In this case, regardless of the size, both implants will be calculated as one type and the tips also will be calculated as one type. Number 6, the information box. Here the applicant can add any comments or information. This can help the reviewer to have better understanding. Number 7 is the shipment documents. Here you must attach all the supportive documents. Number 8 is to add more slides. If your invoice contains more than 1 HS code, you can add more slides from this icon. Number 9 is the save icon. After finishing all the requirements, you must click on this icon to save your request. Now your request will be stored. After storing the request, the applicant should pay the fees through TAM device. Then the applicant must send an email to the cashier employee at the port in order to complete the payment process on the license. The email should contain first the receipt for the payment, including the barcode. Second, the license reference number. Third, the CR number. Fourth, the applicant name and contact number. Here is the required document for UFOQ. First, the invoice. The invoice should include the HS code and the device name and the manufacturer name and country of origin. Second, the quality certificate. For example, the FDA certificate of foreign government or the CE quality assurance certificate and the ISO 13485. It should be verified and issued by a recognized notifying body. Please note that the verification proof should be attached. Also, you have to provide the catalog and the artwork or the label for the imported device. There are some cases require conditional documents. For example, if the invoice is not issued from the manufacturer, in this case, an authorization letter from the manufacturer to the invoice issuer should be provided. Second case, In case the invoice is not issued from the manufacturer or authorized representative, a declaration letter from the manufacturer containing the shipment full details and stating it will be delivered to Bahrain market through a third party. In case of importing a Class 1 item, a declaration of conformity and ISO 13485 should be provided for the imported item. In case of importing contact lenses, surgical instrument, or open NHRA request, sealed sample from customs should be provided. Also, in some cases, NHRA will ask for a classification letter. Please note that you can find all the importation guideline and checklist on NHRA website. Please visit nhra.ph, then go to department, then MDR, then importation to find all the guidelines. Now I will talk about some importation obstacles. NHRA reject the request with comment the certifying body is not recognized by the EU for the quality assurance certificate and IAF for the quality management system. The certifying body should be accredited by the EU or the IAF, so always make sure that your certificate is recognized and accredited. NHRA reject the request with comment the invoice does not match with the certificate. Make sure that the manufacturer name in the certificate is the same as the invoice. NHRA reject the request with comment no quality certificate for the country of origin. Always make sure that the certificate is issued for the same country of origin in the and the quality certificate manufacturing site is UK. So this certificate will not be acceptable. NHRA reject the request with comment the certificate scope does not match with the imported item. Always make sure that the certificate scope are covering the imported item. NHRA reject the request with comment certificate is invalid. Even with a valid date, you should check your certificate before submission to avoid submitting invalid document. Also, some of the obstacles is putting a wrong amount on the price box. Also putting the total invoice price with the discount and shipping cost. Putting wrong amount on the item type box. Always make sure that you're putting the correct type number. Also make sure if your item is registered or unregistered. If it is unregistered, avoid putting the numbers on the registered box. Also attaching any clear document can cause rejection. Please note that some of rejection will be considered as violation. For example, not complying with NHRA rules and requirements, submitting the request repeatedly without complying with NHRA guideline, also submitting invalid document, submitting the same invoice twice. If you have approved request require some modification, you must contact us before submitting the same invoice again. Adding country code or HS code does not require NHRA approval, or adding country code or HS code does not exist in your invoice. This also can cause you a violation.
Thank you very much, Engineer Abdullah and Mr. Abdullah, for your short and direct to the point presentation. We will go now to the Q&A session. There was quite interesting questions and some duplicated, so I'll try to filter them. We will first start with the difference between IAF and NANDO. What is the difference between them?
The IAF consider the ISO, and the NANDO is for the EC certificates.
Yes, I hope it is clear, short and direct to the point. Okay, can MDB certificate be accepted while in the process of transitioning to MDR?
Yes, as long as it's valid.
Yes. Can you explain again the emergency use authorization? Just to highlight to them when exactly NHRA requires it.
It's only for COVID-related shipment. The emergency use, it's a letter or document from the one for the countries, for reference countries, states that the product itself is approved by this country, and it will be marketed or sold until it's fulfilled the requirement for CE or certification.
Okay, and it is only accepted from certain reference countries. Yes. Can you please explain once more the verification should be sent as an attachment? That means, do I need to attach the verification mail to NHRA before applying to UFAQ? They're answering already the question, but if you can confirm. Yes.
Yeah.
Okay, so many people get confused. What do we mean by that? To make sure that the information in the email, instead of just forwarding it, you need to drag it, attach it, and forward it to us if we were not there in the loop initially. Is there any difference between country of origin and made in, or it is the same? If you allow me to elaborate about this, yes. Okay, so when we say country of origin in importation, it is what country that is clearly declared in the invoice and that you need to put in UFAQ system in the country of origin box itself. But when we talk about made in, we go back to the regulation done worldwide, which name we need to put on the artwork, made in which country. And that is, as per the European Union regulation, the name, the manufacturer, who is the entity placing the device in the market, needs to put their name over there. Some of the products have the legal manufacturer clearly mentioned. This is the country of origin of the legal manufacturers. Others have the physical manufacturers, but this is the differences between them. I hope I've explained it. Engineer Abdullah or Mr. Abdullah, if you want to elaborate more, please feel free to add. Okay. This question is for Mr. Abdullah Saeed regarding the medical device item payment calculation. For example, if they have burrs, this item has different shape and description, but all diamond burrs. In this situation, we choose an UFAQ payment as a one item or each as a single item.
This the example I was mentioned about the lenses is comply on this items also. The lenses comes with different power, colors, and different sometimes size. So it's also calculated as a one type. All of them are calculated as one type.
Okay. So the only difference is the different name or type of the device, regardless if they have the same shape, the same color, they will all be under the same feeds, right?
Yes, only one type.
Okay. What is the validity of the verification of the certificate? Via email. Engineer. I know that we have issued a circular in COVID, but if you can highlight the verification by email duration.
I think for now it's 6 months due to the circular, yes. But usually it's 3 months.
Yes, with the COVID situation, we've extended it. Can we consider the Saudi FDA or the FDA instead of EC? So I will divide this into 2 questions. Is Saudi FDA equivalent to EC?
No.
Is the FDA equivalent to the EC?
Yes.
Yes, I think it's better to keep it like this. Okay. If we received rejection in one invoice, then we need to send the same invoice before applying on Ufuk? Yes. I'm not sure if you can elaborate more, but there is no other option. Let's have a live question. Let's see if there is somebody who's raising their hands. No? Okay. So do we need to submit CE and ISO both for class 1 item? Yeah, maybe Engineer Abdullah or Mr. Abdullah, you can elaborate more about when we require CE and when we require CE and ISO, or when we require an ISO. What are the situations that we don't require specific document?
All the requests require the CE and the ISO certificate, but in case of importing class 1 item, a declaration of conformity and ISO 13485 make sure that they are covering the imported item, and there will be enough to process your request.
Great. A lot of them are asking for more examples on verification. I'm not sure, Engineer Abdullah, if you will be able to do that. Just check and let me know, because I've seen a lot of questions asking for another example. But let me just see another question while you confirm if you have a different example. If the HS code from the supplier invoice is not matching Bahrain HS code, sometime last digit differ, supplier is restricted from correcting the HS code as per custom tariff. The question is not there, but I think I understood. What do they need to do if the HS code is not matching with Bahrain HS code, Mr. Abdullah?
They should contact Bahrain Customs to have the most suitable HS code.
So they will give you the Bahrain HS code, because you're not even allowed to change the HS code. I do agree on this. Can you please explain more about verification again? So we'll see if Engineer Abdullah will be able to explain more example about the verification itself. If you want to ask a question live, please raise your hand.
Sadly, I don't have a certificate ready for this kind of matter.
Okay. So yeah, I have some questions maybe about verification that I hope once we ask, we will clarify some of the doubts. We'll answer those two questions and then we'll move to verification questions. We have CE and ISO certificate from one manufacturer, but that certificate expires next month. We can apply now or wait with the new certificate. And let me just clarify, this question is related to importation, not registration. Because if it's with registration, then the answer will be no. For importation, do you accept it? One month valid?
Yes, if the certificate at the date of the submission is valid, the request will be accepted.
Okay. Submission of Saudi FDA is accepted for importation?
No.
No longer. One last question. If HS code is not available in the NHRA list, but the item is a medical device, how they can apply?
Again?
If the HS code is not in our list, what they need to do?
Contact customs.
Yes, you can contact custom to make sure that the HS code is correct. And if it's still after custom tariff department give you the HS code that is not under our list, that means it is not restricted and you can import it without our approval. Now, Engineer Abdullah, you can unmute your mic and get ready for the questions that I hope will serve some of the doubts. If not, please put your questions in the Q&A. Now, you've clearly explained the ideal situation where I have a certificate and that certificate is issued by an entity on the IAF website,
Yes.
right? Okay, so what should I do if I did not find it on the IAF, but I found that, for example, the entity who have accredited the certificate issuer is accredited by one of the bodies on the IAF, not directly. So their name is not there.
As long as the accreditation body that's accredited the notifying body is recognized for or have the standard to accredit another notifying body. So, for example, there is the regional the regional members in the IAF. Not all of their accredited bodies have the standard to issue an ISO 13485. So it depends on how or who issued the certificate.
Okay, thank you. Now, if, for example, I couldn't find on the website that NHRA provided the link to verify my certificate, I was able to see that they are NANDO approved, which again, for those who are asking what is NANDO, NANDO approved list is the entity. Let's say, for example, I am the one who issued a certificate for Engineer Abdullah's site. I cannot issue it unless I am listed on the NANDO list to say that his product is in compliance with the European Union. So a NANDO list is a list of notifying body who are authorized to issue a CE certificate, just to simplify it. So let's say I found their email, I found that they are listed on NANDO, but I couldn't verify. I don't know how to verify their certificate, but I can only access their database, their emails. Can I just send to anyone in that entity and verify it, or is there somebody specific to verify the certificate?
If there is no database available to check or to verify the certificate, you can contact the notifying body itself to verify the certificate for you. Yeah, and
Yes.
NHRA should be included in the mailing group or send it an attachment.
Okay, thank you very much. The number again of the ISO that is recognized for medical devices is?
13485.
And that's it. That you don't recognize 9001. Okay. Let me check if there is anybody raising their hands. No. Okay. So for spare parts, I know that we have removed many of the HS codes for spare parts, but some manufacturers, they tend to use the HS code of the main device itself, and there's no subcategory for it for spare parts. Do they need to provide a quality assurance certificate for spare parts?
Depend on the spare part itself.
Elaborate, please, more.
Yeah, it's how crucial is it to the device itself? Like it's
Foot switch.
screw?
If it's a foot switch.
No need. Just
Okay. Yeah, if it's the X-ray tube itself.
Yeah, sure. It must.
Yes. So yeah. So it depends on the importance of the spare part itself. Does it play a big role in the device mode of action or not? Now, again, with the MDR and MDD, we are accepting them. So please pay attention to the questions while you're typing and try not to duplicate them. So at least we can make use of the few minutes left. If the product is class D IVD product, can we submit EC design certificate instead of EC certificate, as the EC certificate will not have the product code?
can I answer? You have to
Yes.
attach both certificates, DEC and the design examination and the quality assurance.
Both of them. So actually this question falls under the criteria that you said we might ask for it. So it's a good question. In the presentation, there is cases when the invoice is not issued by the manufacturer. Engineer, Mr. Abdallah, can you share your screen on the slide between cases? I will give you some time to share on it. Or if not, if you remember what is the difference between case 1 and case 2? Are you with us? Mr. Abdallah?
Yes, yes. One
Okay.
minute.
Okay, so I will go to the next question. Is it possible to sign the relationship letter describing the third-party manufacturer relation with the legal manufacturer signed by the legal manufacturer rather than the physical manufacturer for importation? No, it's not a valid option yet. So you can only get this from the physical manufacturer, not from the legal manufacturer, and we've discussed this several times. Can we import and sell device from KSA approved in KSA without an approval in Bahrain? I'm not sure if you were with us in the beginning of the presentation, but you should only be in compliance with the NHRA regulation, regardless if it was approved in other country or not. You need to provide all the documents. MDR certificate will replace only ISO 13485 requirements. In case of submitting MDR certificate for importation, we still have to submit CE certificate. I'm not sure how they got this information from the presentation, but can you please, Engineer Abdallah, can you please clarify if the MDR will be replacing the CE or the ISO?
It's
The
a
new
merge.
MDR.
It's a merge of both certificates, so it's covered both certificates itself.
Yes. Okay, Mr. Abdallah, whenever you're ready, please feel free to share your screen. I'll stop when I see your screen. Yes. So the question was, what is the difference between case 1 and case 2?
In case 1, the invoice is issued by the legal manufacturer, for example. So the legal manufacturer have different physical manufacturer, but with different name. So in this case, you need to provide a letter from the manufacturer, the physical manufacturer, to the invoice issuer. In case 2, the invoice is issued by authorized representative or authorized distributor. In this case, a declaration letter from the manufacturer should be provided.
Okay, hope
Sorry, in case of this not authorized distributor, in case of third party.
Okay, thank you very much. If still it's not clear, if you can keep the slide on, please do let us know. I would appreciate it if you're continuing the question, if you can copy that question itself, because I see comments, but I don't know those comments are related to which question. For COVID-related IVD items, can we use declaration of conformity issued by the legal manufacturer as the CE approval requirement?
You can only replace the CE with the reference council approval.
Emergency use approval, yes. Because the document itself, like I'm not sure why those questions are being raised, but let us explain to you the common sense after those response or reply that we're providing you. If the document is issued by the legal manufacturer, it can only be replaced by another document issued by the legal manufacturer. But if the document is issued by a notifying body, you either provide us with a document from a reference country or another notifying body. It cannot be the other way around. As per the NHRA policy, the CE notifying body has to be within EU. But there are some companies that are certified by UK certificate, which obviously is not in the Europe. What should we do in this case? I think they're talking about the Brexit. What is the current situation, engineer?
As far as I know, a lot of certifying bodies shifting now to the NANDOs after the Brexit happened. Yeah. So,
yes. So in case they still did not shift, and they are under the UK only, will NHRA accept that notifying body?
I don't think so.
Okay.
As long as it's NANDO, we are accepting. It's not, we don't have to.
Okay. Thank you very much. I think we're done with questions. Let me check if there's somebody raising their hands for a live question. Mr. Salah? Mr. Salah, you can now unmute your mic. Okay. So with no further questions raised, I think it's fair to say goodbye and see you tomorrow, inshallah, with legislation and classification, where we will talk about medical device regulation enforcement. I have one last question about getting a reply directly about UFOQ pending. Is it possible to get a reply directly about UFOQ pending or rejected cases? The UFOQ system itself is structured in a way that you get a direct response. So maybe the question was not raised in a clear way. Please clarify it. All the requirements and the checklist is mandatory, including labels. We tried to provide you with another example for verification, but unfortunately it's not there. You can always email us if you have a certain case that you're facing a difficulty with, and we can assist you. Okay, thank you very much. Have a good day. مع السلامة.